In my practice, I have designed several different intensives to address very specific goals. Those intensives have a set treatment plan template that I use as my basis for planning. I also use it to adapt as needed to accommodate my clients' various needs. When I began, I started with just one primary intensive that was targeted for couples who were entering into betrayal recovery together. I have since expanded to many other types of intensive templates that I use over the years. You too will have the option to keep it simple and stick to one or two, or you could also develop many variations and custom tailored options. Pick one primary area you'd like to start with today and construct your intensive from the ground up. Now, just because you are picking one area of focus doesn't mean it's a one-size-fits-all approach. For example, in my practice, I utilize the phase of recovery my clients are in to determine which intensive structure that I employ. So, for example, if they are in the first phase, they would receive a foundations intensive that focuses on immediate safety, setting initial boundaries, and best practices for good recovery. If someone was in the third or fourth phase of recovery, I might offer them a more advanced intensive that focuses on complex trauma, making amends, or therapy goals that are aligned with a more strategic coaching approach. I found this structure to be very effective. However, it took a lot of trial and error, structuring and restructuring, running various iterations of these intensives, and receiving client feedback to arrive at these well-established intensives. It may take some experimenting for you and your program before you settle into this kind of groove, and that's perfectly fine. Just keep in mind every intensive, you will learn a lot, and it will help you for future iterations of your intensives. So again, you may be working within one primary scope of specialty, and there might be several variations of an intensive that still fit that basic scope that is the start of your very first intensive. Just remember, therapy is a science and an art. And now that you have the intensive method, you have many tools and resources that we've developed in this course to give you as much structure and order to your intensive as possible. Although the system and treatment plans are very similar from client to client, no therapeutic intensive is ever the same. Begin with a strong foundational framework and hone your craft as you go, and your clients will feel personally cared for and changed by the powerful intensive experience you provide. Even if you have a set structure that you typically follow for each client and you generally know what goals you are able to achieve during these sessions, it is still important to involve them in the goal-setting process. This is your client's therapeutic intensive experience. The best outcomes are made possible through collaborative goal setting. You can begin this process on your screening call or incorporate it as a part of your onboarding process. As you work together during the intensive, you should continue to foster a sense of empowerment and autonomy with regards to their goals. Encourage them to take an active role in shaping and pursuing their goals. From the beginning of your relationship with your client, you want to work to build a strong therapeutic alliance with them. A trusting relationship is essential for goal setting. Use the assessments that you've received from your client to get a thorough understanding about their background, history, strengths, challenges, values, and preferences. Either as a part of your onboarding process or when your client first arrives for their intensive, discuss with your client what their core values and priorities in life are. This is an important consideration. You want to outline goals that align with your client's values. Like core values and priorities, it's also important to take into consideration your client's cultural background so that the goals that you map out align with their cultural contexts and beliefs. There might be a lot the client hopes to achieve during your intensive, so it's up to you to help them set appropriate expectations. You can do this by helping them prioritize their goals, addressing the most pressing issues first. There are some goals you can achieve in the short-term setting of an intensive, whereas other goals may require ongoing effort over a much longer time span. You can help your client set appropriate goals for the couple of days you have together and later as a part of their ongoing treatment plan. Then you can help them map out ways to achieve their long-term goals. By the end of the intensive, your clients should have a clear picture of what they need to do in order to continue their recovery beyond the time they've spent with you. Goal setting plays a crucial role in informing your treatment plan. They serve as a roadmap for therapy, guiding the therapeutic process in a purposeful and client-centered manner. Once you've defined your client's goals, you can focus on specific areas of concern or change. In my practice, a client's goals determine which structured intensive I want to pull off the shelf. A client's goals and the severity of their symptoms inform the selection of appropriate therapeutic interventions. You should have some basic interventions ready to cover content for the intensive, but you can also use your client's goals to decide which techniques and approaches you think would be most effective, adding in additional interventions when appropriate. The priorities you learned about in the goal-setting process will help you prioritize issues to address during therapy. Your treatment plan can be structured to address the most pressing concerns first, ensuring a strategic and effective approach. From the beginning, keep clear and concise records of the goals set and the progress your client has made so that you can use this information to adjust the treatment plan and be a reference for the future aftercare sessions.